Hello, everyone. Thank you, President Harris, and good morning. Members of the Board of Trustees, faculty, staff, parents, family, and friends, and most importantly, class of 2021. It is such an honor for me to be here with you today. When President Harris called me a few months ago, inviting me to speak, I was so grateful for the opportunity, not only to return to a place of enormous importance to me, but to return at this particular time, an unprecedented moment for public health, and arguably the most disruptive moment in higher education in a century. Now, in full disclosure, the thinking process that I've gone through since that conversation has not been without a struggle. First, I had to get over the initial shock that it has been more than 40 years since I have been on this campus as a freshman. I found myself checking and rechecking my math, thinking that cannot be right. And then came the stages, beginning with casual musings about my time here, progressing to deep introspection about my life, followed by the sinking realization that I have zero advice to give you. And then I have so much advice, there's no way I can fit it into 15 minutes. Well, where I settled was to go back to 1984, when I sat where you are sitting now. And I tried to think about what would be most useful to you at this particular moment, at this particular time. Now, you may be surprised about what you remember from Union as the years pass. There were moments here during my college years that felt monumental to me, and they've kind of faded into the background. And others seem so trivial at the time, but they have somehow persisted. For example, I didn't give my Union interview a second thought, not once for 4 years. But when I think back now, I remember it vividly. I remember explaining with confidence that I had narrowed my career choices to being an artist, a teacher, or a physician. And I remember feeling that the person I was talking to was genuinely interested in what I had to say. And then there was a conversation with my calculus professor, who was convinced that deep, very deep down, I did have the capability to learn math, and even that I might come to love math, a prediction about which I was quite skeptical. More on that in a bit. I remember doing poorly on a chemistry exam and going to see my professor, who took the time to notice that there was more to it. And he discreetly handed me a slip of paper as I left his office with the name of a school counselor. And there are other memories for which only later did I appreciate their value, such as my term abroad, where I had the opportunity to live in another country, get immersed in another culture, speak another language, and engage with different perspectives. Those are just a few moments, but they're remnants of a collection of experiences, many of the most important of which were outside the classroom. It's without question I got a stellar education here. But far more important, Union provided me with a sense of community and a sense of belonging, and just enough scaffolding to allow me to stumble and recover. I left with the confidence that comes from being surrounded by people that believe in you. And my journey simply would not have been possible otherwise. To that end, I want to share just a few reflections with you, which I've loosely organized into 3 chapters that might be helpful as you embark on yours. So chapter 1, medical school, residency, first job. From a personal standpoint, the most important thing that happened to me during this period began on a Wednesday afternoon in neuroanatomy when I met a guy who initially irritated me, incidentally, but who I subsequently married, and to this day is my very best friend. Nothing would be possible without Aaron. So lesson 1, there will be nothing as important to your journey and to your life as the people that you love. Cherish them and prioritize them. After residency, I became the director of an inpatient unit and associate director of residency training. I often think back to a conversation I had with someone I really looked up to when I made the decision to not pursue a specialty. He said, "Sue, I'm so surprised. You seemed so ambitious and driven." Do not let anyone, ever equate your degree of passion and ambition with a specific destination that they have in mind. For me, I was steadfast on my journey, and those years allowed me room to grow and to ask some important questions. For example, as I cared for my patients in poverty who lacked access to care, I struggled with the fact that I was a member of a system that failed to recognize health as a human right. And while I addressed their health conditions to the best of my ability, I could do very little about the conditions for health, the social, political, economic factors which influence their health, and their choices and opportunities more broadly. I didn't know it at the time, but that was the root of my passion for public health. So lesson 2, don't be afraid to deviate from an expected pathway. Give yourself time to wrestle with the inconsistency between what we say we want as a society and what we actually do. And imagine how it could be different. Not only will you grow, but you'll leave space for unexpected moments. Now, my unexpected opportunity came with a month-long program at Stanford focused on improving teaching skills in physicians. So there was no space in the section of my first choice, but they had an available slot in medical decision-making, which was based on decision science. Now, I don't know about you, but I had no idea what decision science was. Just in case you don't either, it's a field that draws on behavioral science, economics, psychology, and wait for it, mathematics, that studies how we make decisions and how we can make better decisions in the presence of uncertainty, complexity, and competing values. So short story, after 4 weeks, I was hooked. I knew on the plane home to New Haven that my career was going to pivot. I just had to solve the slight dilemma that the best place to train was in Boston. So here's a soundbite from my conversation with Aaron a few days after I got home. Aaron, I've decided to be a decision scientist. He responds, what the hell is a decision scientist? And don't you already have 2 jobs? And may I remind you, we have 2 toddlers. I quickly reassured him, interrupting. Don't worry, I have it all figured out. I'm going to take the 2 a.m. train. I'll get to Boston by 6, ride my bike to school, take morning classes. I can catch the 1:30, do my homework on the train, be back in time to get the kids from daycare. And as often as Aaron has done over the years, he put his head in his hands. So I went back to school. And for 3 long years, along with the mail and the Amtrak conductors, I commuted to Boston to study populations and policy, only to turn back later in the day to New Haven to focus on individual patients. It was not easy. Plenty of folks thought I was crazy. Some thought I was impulsive and unfocused. But 3 years later, I accepted a faculty position at Harvard. So lesson 3, when you do find that destination that you choose, pursue it without restraint. Be bold, take risks, and use every creative bone in your body to plow through the logistical constraints. You are by far the most prepared graduating class in Union's history to do just that. Chapter 2, research and policy. So there I was, member of decision science as a faculty at the School of Public Health, doing research which predominantly involved, yes, mathematical modeling of viruses. Who would have guessed? Seriously, I never imagined that more than half my career would be working in other parts of the world, that I could be both an analyst and an advocate, or that I'd be able to integrate my intense interest in how we learn and teach into nearly every aspect of my work. Aside from the obvious message to leave yourself open to possibilities you cannot imagine right now, I want to underscore that the path was anything but straightforward. So try not to worry about feeling unsure along the way. Think more about creating a portfolio over time and less about progressing along a linear path. In the meantime, I have a few tips. First, find good mentors. Better yet, build a mentorship team. Different people can help you with different things and for different reasons. A major area of my research was sparked in a meeting with one of my mentors when I proposed a not so great, not really that interesting research idea. And he pulled out a stack of cards from the top drawer of his desk, tossed them across the table, and said, here's a collection of questions that I think are really important, but I haven't had time to pursue. And yes, my work on HPV and cervical cancer in more than 70 countries across 20 years started with a random card I picked up from that table. Second, work on problems that you think are important and work on them in a way that aligns with your principles. Be careful about overly fixating on metrics that just reflect just one dimension of progress. For example, as a tenure-track faculty member, there's a lot of emphasis on the number of scientific papers you publish. But much of the most important work I did, building collaborative relationships, listening to people's stories to understand their needs, spending time to find compromise with stakeholders who disagreed with me, may not be reflected in papers. So metrics are important, but find a balance. Third, compromise whenever you can, but realize that some things are never worth compromising. Integrity, honesty, kindness, and empathy. Fourth, you will make mistakes. You will try things that fail. You'll face setbacks due to factors that are out of your control. But what you do have control over is how you embark on your journey, how you get up after you fall, and what values guide each and every one of your interactions. And finally, be intellectually curious. Find the joy in learning new things, in particular, beyond the boundaries of your field. So that brings me to my final chapter of service and leadership. Sometimes opportunities arise out of transformative changes in society or events that you just can't predict. In my case, this took the form of being asked to lead a cross-university institute that was charged with transforming the way we think about and work together on global health. And by global health, I don't mean the health of poor countries. I mean the health of every person, everywhere, regardless of where they live. This didn't come at a convenient time. I was knee-deep in my research, but it was an opportunity to have a broader impact in ways that aligned with my deepest convictions. And it was also time-sensitive. There was a growing consensus about the connection between health and development, human rights, and security. And it was an opportunity to motivate, to innovate in the educational space. I believed then, and I still do now, that if we are to equip future generations to be interdisciplinary change agents, then we need to think in new and innovative ways about the what we teach, the who we teach, and the how we teach. You have probably gained some insights in the last year about the value of innovating on the how to teach. But just imagine if you were born in a place where higher education was only available to you in no other way but digitally. You too are likely to be faced with opportunities that mean putting a collective cause in front of your individual goals, at least temporarily. Embrace those opportunities. They may lead to the most important work you will ever do. Now, let me bring this back to the present. From a global perspective, the toll of COVID-19 has been almost unimaginable in so many ways and across all of society. Yet, it is but one of many 21st century global challenges. There are other emerging infectious diseases with pandemic potential. We are facing climate change, migration crises, displacement. What is common to all of these, in addition to their impact on health, is their relevance to every sector of society, and the reality that no one nation can address them alone. We must find ways to work together as a global community. The good news is that there's an equal set of opportunities. Advances in knowledge, from biomedical science to material science, new technologies, some of which are game changers, like the cell phone or mRNA vaccines. Some of you may directly work on these global challenges, and some of you may contribute to creating new global opportunities. But the challenge for all of us is, how do we level the playing field? Because right now, the most vulnerable in society bear a disproportionate burden of the risks, and the best off disproportionately benefit from those opportunities. In this regard, each and every one of you has a role to play, regardless of your ultimate profession. Now, from a local perspective, you already know too well the far-reaching consequences of this pandemic in the United States. And without a doubt, it has exposed in the most glaring of ways our societal inequities. But these are not new. They have roots in structural factors, including racism, that have been deeply embedded in our institutions and our communities for decades. And we need to remember, we have other epidemics: opioid addiction, gun violence, misinformation, all made more complex by the unprecedented divisions between us. My message to you: take these challenges on with courage and conviction. You will need to lean forward, seek the truth, speak up, and fight for what you believe in. And you will also need to find ways to listen and even empathize with those you really disagree with. We need to find ways to recognize our common humanity. Be a leader. Whether you accept a leadership role, volunteer for public service, or demonstrate leadership through your daily actions, you must step up. Your journey begins at a moment of intense disruption, and without a doubt, there are sobering challenges. But I believe with all my heart, there are uniquely transformative possibilities from such intense disruption. My greatest source of optimism comes from the promise of your generation. And like me, 37 years ago, you are leaving with the confidence that comes from being surrounded by people who believe in you. I sat where you are sitting now, and I know that you are prepared. Find the moral conviction to use the foundation established here to not only imagine the possibilities of tomorrow, but to make them a reality. I wish you all the very best in your journey as you begin your next chapter. Congratulations, class of 2021.